recognized.
Mr. Speaker, at this time I'm pleased to yield 3 minutes to the Vice Chairman of the Energy and Commerce Committee, the gentlelady from Tennessee, Ms. Blackburn.
The gentlelady from Tennessee is recognized for 3 minutes.
Thank you, Mr. Speaker, and I thank the gentleman from Pennsylvania for the great work that he has done on this bill. Mr. Cherry has also done great work on this bill. You know what is so interesting, and one of the reasons we find it necessary to come and address these issues, Secretary Sebelius told us in December, 5,000 people a day were getting access to health care that they had not had before. The other side of that story, which was not told, 74,000 American families a day were getting cancellation notices. They were looking at one another across the dinner table and saying, guess what? Our insurance has been canceled. It has had a devastating effect. And as we try to do oversight and due diligence and continue to push for that oversight and due diligence and carry it out even this morning at Energy and Commerce Committee, where we've had Mr. Cohen, what we have found is it's very difficult to get information, even when we're sometimes hearing from employees they're admitting what they told us was wrong, but then we do not get the straight story. So it is very appropriate that we require HHS to release weekly detailed reports about the exchanges, including their enrollment, their functionality, the efforts to address the technical issues at healthcare.gov. Absolutely. Absolutely, it is appropriate because this is all being done with the taxpayers' money. The American taxpayer has paid for every bit of this. It's not the federal government's money. It's not President Obama's money. It's not Congress's money. It is the taxpayers' money, and this is a failed rollout and a failed program. Now, this administration was supposed to be the most transparent administration in history. It has not been that. It's well documented that it hasn't been that, and indeed the rollout and the implementation of this law has been even less transparent. The reason, I think, is because there have been so many problems, such as thousands, millions of Americans losing access to their health insurance. None of the information being shared by the administration regarding enrollment means much of anything. We talk about people that enrolled, but we don't know how many people have paid and how many people have completed that process. What are the demographics of the individuals that are enrolling? All of this is information that the individual that is paying for this, the American taxpayer, deserves to know. Who has paid for this insurance? The White House has backed away from using any measure of success as a means to determine success. But as recently as September, Secretary Sebelius herself said that 7 million enrolled by the end of March would define success of the law. Well, is that 7 million that go to the website, put an insurance product in their cart, and then go think about it? You know, Mr. Speaker, when I was growing up, I spent a lot of time working in the retail industry, selling clothes in a little dress shop. Now, every once in a while, we would have somebody, they would come in, they would put something on hold, and they would say, I'm going to be back. Well, we called them the be-backs, because guess what? More often than not, they did not come back and complete that purchase. Yes, they put it on hold. Yes, they put it in an online shopping cart, but then they move away from it because this program is broken, it is too expensive to afford, and the American people do not want it. I yield back.